Mr. Berg? Mr. Berg, how you feeling today?
Oh.
Mr. Berg? Mr. Berg? Can I get some help in here?
This is Kim McCoy at Sentara Healthcare. We have a code blue in room 101. Thank you.
Here's the code card. Code blue, room 101. Code blue, room 101. Code blue, room 101.
Okay, I'm getting ready to shock. I'm clear, you're clear, everyone clear. Shock delivered. Start CPR.
Okay, your compressions are good. You feel a pulse with your compression.
300 milligrams of amiodarone. And the IV is flushed.
Hold compressions real quick. I'm seeing a change in rhythm.
It's a good strong carotid pulse.
Oh, and we got sinus rhythm on the monitor.
Great job, team.
Well, simulation is a tool that really is meant to revolutionize learning. Adult learning theory really responds around, is it practical, is it real, is it something that I can use immediately relative to my job? Simulation is an exact blueprint of what that looks like.
We made a decision in our simulation journey that for it to be really effective, we wanted some type of equipment at every hospital. And so we got really fortunate. Last year, we spent the entire year working for Strategic Capital, had great support from senior leadership, and were able to get that by the end of the year.
We've been moving our competency of our educators and how do you really use simulation as far as a learning technique. We've put more resources in terms of the mannequins and those kinds of things. We're redesigning a curriculum in terms of how do you integrate simulation into the practice. So we're making a lot of progress right now, a lot of great things to come.
What we found is the generation that we have are gamers. They like to put their hands in the game, they want that virtual reality, and for them to be able to have that prior to going into the clinical setting is absolutely enormous.
The technology part of the mannequin that I like the most is when I have a learner go to feel for a pulse and get so excited and say, I can feel his pulse, or I can hear his breath sounds, I can see his chest rise and fall.
The baby can also move, it can breathe, it has a heart rate. You can make it not have a heart rate, you can make it look cyanotic.
Our mannequins interact with us, they talk back. We have them hooked up to monitors that show us their heart rate, have an actual EKG strip running. We can get live blood pressures from them. So it's really a live interaction.
You know, the baby does turn blue, the baby does move and have a tone, and the baby breathes and cries, and I can see that they're having an adrenaline response because they actually say, you know, my heart's beating so fast. It's truly creating that environment where, you know, they think the baby's going to die.
It's like there's times that your heart starts racing and you really are interacting and thinking that you need to save this patient, but you also feel safe because you know it's not real.
Some of the things that we worry most about don't happen, but we don't get to practice on them. So this is an opportunity for us to really set up those low volume, high risks.
When we have a serious event, we can actually recreate that event and walk the staff through that, the staff, the physicians, and determine what went really well and what maybe didn't go so well, and reteach them maybe what a better response or a more appropriate response would be. So if they're in that situation again, they know and they've practiced what the appropriate response is.
With simulation, I think the airline industry has shown it very well that you can create a difficult situation and then show the pilot, show the physician, show the technologist, show the nurse what's going to happen. It allows them to plan down the road. They may not see the emergency coming, but they know how to deal with it. It's not a substitute for experience, but it certainly makes it easier to accumulate the experience in a safe manner.
What the simulation sort of addresses the gamer and entices them into being able to really want to learn what the next step is, being able to anticipate the next step and predict the next step. When something is getting ready to occur, it's already been anticipated so that it's not a surprise and the next step becomes fluid as opposed to a reaction. It's truly an educated response. So at that point, we're able to move forward in an expeditious manner and take care of our patients exactly the way we want to, with the high-tech, high-touch, technology-based mind and skill set.
One of the outcomes of simulation that shows success is that it's not sitting there. Many people have bought mannequins and they're in closets. We made a decision that that was not going to happen with us. And so we decided to take a very successful program that had been at Williamsburg, our Code Blue scenario program, and to roll that out to all 7 hospitals. Successfully, that has happened.
Historically, nurses have to have BLS and ACLS if they work in some high-risk environments. And you take your BLS, your life support classes, every 2 years. And what we found through research is that the skills degrade very rapidly. Within 3 months, your skills drop off, and by 6 months, they drop off as if you've never even taken the class. And we thought if we brought in a class that was totally hands-on, this would assist our nurses with their learning so that they could practice those skills and stay current. It's not just about the mannequin, it's about the entire way of teaching the class. To where instead of the instructor being didactic and telling everybody what they need to do, in the actual class we're expecting our learners to actually perform and give them feedback based on their performance.
The annual assessment really verifies what that staff member knows about a certain situation. And by doing it in simulation, you're able to validate they're doing what they say they do.
I believe what we started to see is how we could accurately look at how a healthcare provider was doing, a nurse, a respiratory therapist. We really could determine where their level of understanding was and where their level of competency was.
You have them do the assessment, identify what the problem is, and then take the interventions needed based on what the assessment findings are. It has definitely improved in the outcomes because they already are saying, you have given me the confidence, I know what to do when it occurs on my unit.
Something that's kind of difficult to really give the student is how they are perceived. And I believe that simulation does just that, particularly with our sim suite, where we can record everything that has occurred and then on the back end debrief so that you can actually see what you look like.
One of the ways I think debriefing works really well is to use a method called Socratic Questioning, where you actually ask the students to think out of the box and give an open-ended question. During the debriefing time, you can actually go back and really have an understanding of where the students processed information. So I think that's an opportunity that sometimes is missed in clinical, that we have the option of using the technology to capture.
There is probably not one area of Sentara, I'm talking non-clinical too, that won't benefit from simulation of some form. Because remember, simulation is not about the mannequin. It's about creating a real environment so that when I go to that real place I'm going to work, I've already been able to experience it.
I think we're very excited about using simulation in more team scenarios, reproducing scenarios from our operating rooms or in a code situation.
I'm hoping that the amount of mannequins that we can have will increase over the years because I truly believe this is the way of education in the future.
There's so many opportunities out there. Get away from the classroom setting so it's more hands-on, more practical, and it's incorporating your everyday activities into what you really learn.
Several weeks after I did the Code Blue class, I actually experienced a real code. One of the patients I was taking care of with my preceptor wound up in serious distress, wound up with really high respirations and no heartbeat. So we called a code and it was exactly like what we practiced in our simulation lab. Everybody came in and was assigned specific duties. They switched out with compressions just as we do in class. So our simulation class really prepared me for what it would be like in that code.
I was watching the video this morning of the Sullenberger landing in the Hudson. What a dramatic video, and he is absolutely candid that if he hadn't gone through that training in the simulation, in the simulators, for hours and hours and hours, he would have not been successful in doing that. And it was just so evident that practicing those rare but very, very impactful high-risk type of situations and doing that in a safe environment is all what simulation is about. And we want to be able to transition that to the bedside and to be able to help our staff and our clinicians to increase their own confidence, but also to increase this quality and safety for our patients.
Many walk out saying, that was a great way to learn. Now that's the exciting part, because you took somebody who may have been intimidated going into it and they walked out and said, I could see so many other ways to use this. So what we have to do is not limit our imagination and not stop at any barriers. And I'm really excited too because I think working in combination with the college, we're going to really see a change in our students, nurses that come out, and we'll be able to really then also benefit from embedding some things early on. So I'm really excited to see where we'll be. I think we're on a journey. I think it used to be a path and now it's a highway, so to speak, and I think we've got some really good momentum going. And I really think a lot of that came because of the leadership backing that allowed us to get the strategic capital that said, go for this, make it happen.